Ranjan, Associate Professor Surgery Department, ANHS, Gaya. Now today we start breast cyst. They occur most commonly in the last decade of reproductive life due to or non-integrated evolution, stroma and epithelium. They are often multiple, mainly bilateral and malignancy. Diagnosis can be confirmed by aspiration and ultrasounds. Treatment of the breast cyst, solitary cyst or a small collection of cysts can be aspirated. If the resolution resolve completely and if the fluid is not blood stained, no further treatment is not required. If there is a residual lump or if the fluid is blood stained, a core biopsy or local excision of histological diagnosis is advisable. Blackosy, which is rare, usually present a solitary subareolar cyst and always death from lactation. It contains milk and long-standing cases its wall tends to calcify. Fibroadenoma, these usually arise in the full developed breast during the 15 to 25 years period. They arise from hyperplasia of kidney lobule and usually grow up to 2 to 3 cm in size. They are surrounded by a well-marked capsule and can thus be manipulated through the cosmetically appropriate incision. Giant fibroadenoma can occur occasionally during puberty. They are over 5 cm in diameter and often rapidly growing. Treatment manipulated through a submembrane incision. Fibroid tumor. This benign tumor, previously sometimes known as xerocystic disease of bodies or cystosarcoma fibroids, usually occur in women over the age of 40 years but can appear in younger women. They present as a large, sometimes massive tumor with an unevenly bruise-related surface. Occasionally, ulceration of overlying skin occur owing to pressure necrosis. Despite their size, they remain mobile or the chest wall. There is low malignant potential resembling a fibroadenoma. The latter may recur locally, but despite the name of cystosarcoma fibroids, they are rarely cystic and only very rarely develop features of a sarcomatous tumor. These may be metastases via the bloodstream. Treatment of the fibroid tumor. Treatment of the benign type is initiated in very young women and wide local excision. Massive tumor, recurrent tumor, and those of malignant can be massive tumor, recurrent tumor, and those of the malignant type will be required mastectomy. Carcinoma of the breast. Breast carcinoma. Breast cancer is the most common causes of the death in middle-aged women in Western countries. Etiological factors. Geographical. It occurs commonly in Western world, accounting for 3 to 5% of the deaths. In developing countries, they account for the it accounts for 1 to 3% of the death and rare is Japan. Is rare below the age of 20 years in incidence. Steadily rise so that by the age of 90 years, nearly 20% of the women are affected. Gender, less than 0.5% of patients with breast cancer are male. Genetic, it occurs more commonly in women with family history of the breast cancer than in the general population. Diet, low of associated with an increased risk of developing breast cancer. Endocrine breast cancer is commoner in newly parents women, and breastfeeding in particularly appear to be protective. Also protective is having first child at the early age, especially if associated with late menarche and early menopause. It is known that postmenopausal women breast cancer is more common in obese. The role of exogenous hormones, in particular the oral contraceptive pills and HRT, risk of developing breast cancer. Then is in the likelihood of developing breast cancer associated with the above risk factor is usually quantified in the term of the relative risk RR. Thus, an RR of 2.0 means that the individual has twice the chance of developing breast cancer as the average for the population. Whether an RR of 0.5 indicates a risk reduction of 50%. Pathology. Breast cancer may arise from the epithelium of the duct system anywhere from the nipple and in of major lactiferous duct to the terminal duct unit, which is the breast lobule. The disease may be entire in situ and increasingly common phenomenon with the advent of the breast cancer screening, or maybe in breast cancer. The degree of the differentiation of the tumor is usually described by the three grades: 1, well differentiated; 2, moderate differentiated; and 3, poor differentiated. Commonly, a numerical grading system based on the scoring of the 3 individual factors: nuclear neomorphism, tubule formation, and mitotic rate is used, with rate third cancer roughly equating to the poorly differentiated group. Previously described terms were used to classify breast cancer: serous carcinoma meaning woody, or medullary carcinoma means brain-like. Current culture. Ductal carcinoma, it is the most common variant, but lobular carcinoma occur in up to 15% of the cases. Inflammatory carcinoma is the fortunately rare, highly aggressive cancer that presents as a painful swollen breast which is warm with cutaneous edema. This is due to blockage of the subdermal lymphatic and with carcinoma cells. Inflammatory cancer usually involve at least 1/3 of the breast and may mean a breast abscess. A biopsy will confirm the diagnosis and show undifferentiated carcinoma cells. In situ carcinoma is pre-invasive cancer that has not been reached the epithelial basement membrane. This was previously rarely usually symptomatic finding a breast biopsy specimen, but is becoming increasingly common owing to the advent of mammographic screening. In situ carcinoma may be ductal or lobular, the latter often multifocal and bilateral. Paget's disease of the nipple. Paget's disease of the nipple is superficial manifestation of an underlying breast carcinoma. It presents as an eczema-like condition of the nipple and areola, which persists despite local treatment. The nipple is eroded slowly and eventually disappear. If left, that underlying carcinoma will sooner or later become clinically evident. The state of breast cancer. The state of breast cancer First, local spread, second, lymphatic metastasis, and third, bloodstream. Clinical presentation of the breast carcinoma. Symptoms: patient presents with a painless lump, mostly in the upper and outer quadrant of the breast. Pain is present only about 10% of the cases. Nipple discharge is uncommon but may be only symptoms. There may be large shrinkage or asymmetrical of the affected breast. Sometimes the patient presents with metastatic symptoms like backache, chest pain, jaundice, etc. Sign of the breast carcinoma. A lump is usually hard, not tender, minimally mobile with indistinct borders. In locally advanced carcinoma, there may be erythema, pudiorange, ulceration of the skin, or fixation to the chest wall. Axillary and supraclavicular lymphadenopathy, sign of metastatic disease, hepatomegaly, bone tenderness. Nipple discharge, destroyed, deviated, displaced, depressed, discharging blood, or discolor. Stage of breast carcinoma. There are two traditional systems of classification of breast carcinoma. These are the Manchester systems and the other is International Union Against Cancer, TNM, tumor nodes metastasis staging system. Staging of the breast cancer is stage 1, TIS, no probable, no palpable tumor, no grading, no clinical event, no nodal metastasis or distant metastasis, no. Second, grade first and T1, tumor grading is 1 and stage first, tumor less than 2 centimeter, lymph node is not enlarged, clinical evidence not finding, and third, staging third A and T3, tumor no. Stage 2 is the T2 or tumor is more than 2 to 5 centimeter, lymph node is 1, mobile axillary lymph node, and stage 3A, T3, tumor is more than 5 centimeter or lymph node is 2, fixed axillary lymph nodes. Stage 3B, the tumor grading is T4. Any size introducing skin of chest wall, lymph node N3, supraclavicular ipsilateral nodes, and stage 4 distant metastasis. Now I discuss the prognostic classification of the breast cancer group. Very low risk primary breast cancer, more than 90% of the survival 5 years. The screening detect as DCI globular or spreading. Special time, treatment is only local. Low risk primary breast cancer, 70 to 90% is survival 5 years. Note negative with favorable histology. Third, high risk primary breast cancer, less than 70% is a 5-year survival, and locally advanced less than 30% 5-year survival. Now last metastasis primary systemic. Prognosis of the breast cancer, the best indicator of likely prognosis in the breast cancer are still tumor size and lymph node status. Investigation of the breast, mammography, ultrasonography, MRI, excision biopsy or FNA, BC, chest X-ray of the lungs for metastasis, radioisotopic bone scanning, estrogen, progesterone, and HER2 neuroreceptors except from the excised biopsy specimen. This is important for planning of treatment of and prognosis. CBC, serum alkaline phosphatase, SCPT and calcium channel. Treatment of the cancer of the breast. The two basic principles of the treatment are reduce the chance of local recurrence and the risk of metastatic spread. As such has been indicated above, the treatment will be largely depend upon the clinical stage of the disease and presentation, including not only classical TNM staging but often other tumor types such as tumor grade. Treatment of early breast cancer will usually involve surgery with or without radiotherapy, systemic therapy such as chemotherapy or hormone therapy, surgery, simple mastectomy or radical mastectomy. The male breast gynecomastia, atriopathy, etiology, hypertrophy of the male breast may be unilateral or bilateral. Breast enlarge at puberty and sometimes present characteristic of female breast. Hormonal enlarge of the breast often accompanied stimulatory therapy for the prostate cancer, not rarely used. Associated with leprosy, associated with liver failure, associated with Kellan-Poulter syndrome. Treatment of the gynecomastia. Reassurance may be sufficient. Mastectomy with presentation of the areola, preservation of the areola and nipple can be performed. Carcinoma of the breast, carcinoma of the breast, carcinoma of the male breast, carcinoma of the breast accounts for less than 2% of all cases of the breast cancer. Treatment stage for stage, the treatment is same as for carcinoma in the female and prognosis depend upon the stage at presentation. Lipoma, as a true lipoma is very rare. Sarcoma of the breast usually of the expanded cell varieties and accounts for 0.5% of malignant tumor of the breast. Sarcoma tends to occur in younger women between the age of 30 to 40 years. Treatment is by simple mastectomy followed by the radiotherapy. Metastasis occurs occasionally. Now today we finish the breast chapters.